Hi everyone, Dr. Brian Steiner here of Open Spinal Care in Mount Pleasant, PA. So I lied to you guys last week when I did my vlog on x-rays. I said this week we were going to start on disc. I decided to switch things up a little bit. I'll do disc next week. This week I'm actually going to talk about the human spine. And if you notice when you read my blog this week, it said the hub of the nervous system. Again, when I talked in one of the very first blogs, we talked about the human spine is the protective case for the nervous system. So that's why I came up with that little title there. I thought it was pretty cool. So we'll start with the human spine. It's a little bit of a longer blog this week. There's a lot of content. I'll try and make this as easy as possible. But again, if you guys have questions, please don't be afraid to ask me. I'm not opposed to answering any questions. I love answering questions. But let's start with the human spine. So first, there's two different reasons why we have the spine. First one, it helps with movements, flexion, extension, lateral flexion, and rotation. The second thing, again, it is the protective case for the nervous system. Remember, these are all nerves. The nervous system, the central nervous system, is all within the spine here. So I'll break down each section of the spine here. And again, if you guys have questions, I can go into further detail with it. So we have 5 different sections to the spine. We have the cervical, the thoracic, lumbar, the sacrum, and the coccyx. The pelvis does not count within that section. I'll talk about the pelvis alone in a different blog. But let's start from top and work our way down to the bottom. The cervical unit here, you have 7 bones in the cervical unit, C1 through C7. C1 and C2 allow for different motions. C1 allows for up and down rotations. C2 allow for left and right rotations. C3 through C7 work more with flexion, which is looking down, extension, looking up, turning left, turning right, and then bending side to side. That's called lateral flexion. So, biggest things here, what the cervical spine has. First thing is it has a curve called the lordosis. I'll explain curves after I go through the entire spine. It has a lordotic curve, which means it has a C-shaped curve to the spine. The lumbar spine also has that as well. The thoracic spine, will go into that in a little bit more detail. But what the cervical spine does, besides posture related and allows motion of the neck, another big thing that it does, if you look at this red little line right here, that's a blood vessel right there. The cervical unit from C6, they have little holes, all the way up to C1, have little holes here called transverse foramen. This allows blood to be supplied to the brain. So that's another big portion of why the cervical unit is so important. Obviously, there's nerves in here which allow control of the arms, hands, and fingers. And whenever there's a misalignment in the cervical unit, it causes there to be numbness, tingling, weakness in the arm, neck pain, all that kind of stuff. Now, moving on to the thoracic spine here. Another part I'm going to talk about with the thoracic spine is the rib cage real quick. I don't have an actual skeleton to actually show you the rib cage, but I'll explain that a little bit more in detail. The thoracic spine starts at T1 and it goes all the way down to T12 in the area down here. The thoracic spine has a little bit more limited range of motion compared to the cervical unit. The thoracic spine doesn't have too much flexion and extension. It does more rotation. And that's because of how the facets are set up in the thoracic spine. Now, the thoracic spine has a curve called a kyphotic curve, which gives it a little bit more of a hunch. Not obvious, this is more of exaggerating, and I'll explain the curves a little bit more. But again, it helps with posture-related surfaces and shock-absorbing surfaces as well. So in the thoracic spine, you have 12 bones, you have 12 discs. Now let's talk about the rib cage real quick. The rib cage protects the nervous system. It protects this area and protects the chest cavity. And there's 12 ribs along with it. The ribs are also very important in protecting internal organs, but they also assist in helping inhaling and exhaling as well. Now, the thoracic spine, when someone has a misalignment or pain in that area, a lot of patients will complain of breathing issues, stomach issues. They'll even get a little bit of tingling like in the back of their arm and even into their shoulder blade areas. So those are all things you want to note if there's a misalignment in the thoracic spine. It's actually the most uncommon area to be adjusted in because, believe it or not, most issues come from either the lumbar side or the cervical side. So going down to the lumbar, this is now the third section here. The lumbar goes back to what the cervical unit is. So lumbar has that lordotic curve that cervical curve has. and it also allows for all ranges of motion, just like the cervical unit, especially L4 and L5. Flexion, extension, and then lateral bend, and then rotation. That's all coming from the lumbar spine right here. So when someone has a misalignment in the lumbar spine now, they're going to start getting pain in their down their legs, into their toes, numbness, tingling, and they're even going to start getting some malfunctions as far as having a problem going to the bathroom, having a problem with the reproductive organs, stuff like that. So those are common conditions that happen with the entire spine. Now I'm going to stop with the lumbar unit for a second. I'm going to go over here and talk about the curves real quick. So again, cervical, lumbar curves are the same. They should have that lordotic curve, which is that C-shaped curve to it. Now again, everyone talked about how great my artistic skills were a couple weeks ago, so I just had to do them again for you. This is, and it's not perfect. I'm no Pablo Picasso, but it should have a nice curve, just like that, nice C-shaped curve. Whenever you have an exaggeration of that C curve, it's called a hyperlordosis. And whenever you have that loss of curve, whether it's straight or this, it's a reverse curve, or the more medical term for hypolordosis. Now, the thoracic curve has that kyphotic curve, which gives you that little bit more of a hunchback, but obviously not too much. In a normal situation, this may not be perfect here. That's normal here. Now, this is more of that hunchback person. That's like the hunchback in Notre Dame right there. That's what they call the hyperkyphotic curve. Now, when there's no curve to the lumbar spine, it has a hypokyphotic curve. So those are the things with the curves. You can go push back. But with these curves, what they're doing is they're helping to, obviously, with your posture, and they're helping out with shock absorbing surfaces. Now, last part here, we have the sacrum and the coccyx. The sacrum has 5 fused bones. They're fused together, and they make up 5 sacral nerves. The coccyx can have 3 to 5 little bony segments. Both of them do almost essentially the same thing. They're both for weight-bearing surfaces. Now, the lumbar spine is for weight-bearing surfaces because it holds the weight above, hence why these bones are bigger. But the sacrum and lumbar, or sacrum and coccyx, also have that weight-bearing job done to it. The only difference with the sacrum and the coccyx is that the coccyx is done for more weight-bearing surfaces when sitting, where sacrum supports while you're standing. Now, they also have nerves in the sacrum and coccyx area, and they also go down further, like with the lumbar. They help function the sex organs, they help function bladder, bowel habits, and part of the lower small intestine, large intestine as well. So, as you can see, that was a lot of information to take in. It is a lot of confusion, hence why I urge you, if you have questions, that's why I want you to, and I'll answer any questions that you have. Now, what do we do in these cases? Obviously, our job is to help the interference of the nervous system. We adjust all these regions right here. It's a series of adjustments. Now, notice I said the word series. Chiropractic's not a one and done type of a process. It takes a long time. Some patients it takes a couple weeks, some takes months, some take years. It just depends on how long they've waited. That's why we have more than just chiropractic here. We have decompression, we have neuropathy services. These things can help, and they do help because we see patients get better every day. So if you have any questions, I urge you, again, please let me know. This is a lot of information to take in, but it's information that will help you understand a lot more of why our bodies respond the way that they do. Now, next week, I will talk about the disc, I promise you. So if you have any questions in the meantime, shoot me a message, give us a call, and again, we'll answer any questions for you. If otherwise, have a great day. Enjoy our rainy day. It's supposed to get nicer throughout the week, so enjoy the rest of your day.